Welcome, everyone. It's a beautiful day here, and we've got a great program set up. What I'd like to do to start, though, is I'd like to ask Dean Michael Klag to come up and welcome and say a few words from the Bloomberg School of Public Health. So thank you.
Very cool. Thank you. It's great to be here, and I want to thank Daniel for collaborating and for the organization for collaborating with us. So I'm here just, I guess, not on behalf of the school, but of the university as well. This is the 11th symposium, as you said, and the 5th that we've had here at Hopkins. And I remember very well when I first met Daniel through the auspices of Laura Morlock and learned about Stewards of Change. And the mission just resonated so much with what our school wants to do, and that is tackle big problems, improve the lives of people everywhere. And we have a big interest, of course, in providing information and making information available, in this case to improve health and human services. Some of you I've met before and when I've spoken, and you know that I have a daughter with autism, and when we tried to apply for Medicaid and Medicare for her, I'm a physician, I'm a dean, I have an MPH, my wife is a biostatistician. It was really, really hard. And it's hard, you know, I'm not paranoid, but it's difficult not to believe that people don't want you to get services. I mean, it's just so difficult, as you all know better than I. So the fact that you've assembled leaders from around the country to tackle this problem is a great thing and something we hope to continue to support. We just are in the midst of celebrating our centennial as a school. And our school was a place where much of the model of academic public health was set. Many of the departments in schools of public health that you think of as schools of public health, we were the first ones to have them. So we've been at this a long time, and this last week, on Thursday, we had the capstone for our centennial celebration, and we held a symposium on the future of public health. So similar kinds of thoughts about, to really change the future, we have to think about the future and we have to plan. About 5 years ago, our Center for Injury Prevention and Research celebrated its 25th anniversary. And to do that, we had somebody from the CDC come from the Injury Center, and they presented data on opioids. And I was flabbergasted. So as somebody who used to practice medicine, I could just see as they presented the data on the number of deaths, the number of people who abuse and misuse prescription drugs, how medicine, pharmacy pharmacists, drug manufacturers, everybody was complicit in creating this problem, often for good reasons, right? People who were advocates for pain relief, push for pain as the 5th vital sign. I had to check a pain scale for every patient I saw, and if I checked there was pain and didn't address in my note, I was asked why. And so for many good reasons, we all created this epidemic. And it's a perfect, in many ways, problem for public health because it's a big problem. It's going to be tough to fix. It's complex. It has multiple stakeholders, and so to solve it, you need to have not just a law enforcement and enforcement kind of strategy or a physician continuing education strategy. You need multiple strategies, and so these are the kinds of things that your organization just takes on, and so I was, as I said, pleased to be here today and to have you here, but also really happy that you're taking on this very difficult issue, which I know that you and the people in this room putting your heads together are going to have a big impact. So thanks and welcome. Okay.
Thank you, Dean Klag. It's, as you said, noteworthy that you're celebrating your centennial here. We as stewards are entering our 2nd decade, so as going into our 11th year here, and sometimes it feels like we've been on the long march, and it feels like it's been 100 years.
Especially today, right?
Yeah, especially today, right? Nothing like a little last-moment anxiety and adjustment. Yeah, right. You got a couple of painkillers? Yeah. Be careful if you drink the punch here. We'll get everybody really happy going here. You know, it has been a decade of us doing this work, and it's been 100 years of you doing this work. And I suspect that there is no end in sight. So sometimes I wonder, and we talk amongst ourselves and with our team, whether or not there is going to be we're going to get there. And the answer is no, we're never going to get there, right? It's going to be a continually unfolding process. And so we really should stop occasionally and smell the proverbial and the real roses and think about the progress we've made along the way and the progress we are making along the way, because it's very easy to get into the cynical zone and look at the problems and the issues that we have. And that's one of the reasons why we do these events, and I think it's one of the reasons why we keep going, is to really acknowledge and look at and bring people together to help think about those things. We've been very intentional this year in terms of broadening our view, our participant, not only the individuals, but the organizations that are involved. You may have noticed from some of the language that we sent out as we were preparing for this, we talked about networks and networks of networks and how we are going to connect people. And so we've been very intentional about that. And what I'd like to do, without naming everybody immediately, you don't have that chance, is I want to ask you to stand by group, okay? So just to get a sense of who's in the room here. So if I could ask our state and local partners to stand up, and we have representation from a lot of states: California, Oregon, New Mexico, Michigan, Minnesota, New Hampshire, Vermont, Connecticut, Pennsylvania, I think also Virginia, and a couple of other places if I'm missing. So New York City, thank you, right. Thank you, Andrea. So come on down. Our federal partners who are not stuck in the tunnel, you guys can stand up. There are several of us here. And over the couple of days, we have a great representation of different federal partners who are dedicated and interested in getting here, and hopefully they will arrive here in the not too distant future. From a association perspective, if you're part of an association, please stand up. So we have a number of folks from APHSA and ASTO and CWLA who will be here as well, and NACO. So we expect a number of folks from there. And then the foundation, and I'm going to lump you guys together, the foundation, academia, and the judicial communities, and the nonprofit community that we have here as well. So we have a nice sampling. And then the remaining iconoclasts and consultants who are, put yourself into that group. There's Ivan. And there's other friends. Great, the iconoclasts have arrived. Yay! You all should be standing for that one. Thank you very much. So we're really proud of the fact that we're moving into our second decade and that we're able to sort of move this agenda forward. You'll notice in the name of this particular conference, Interoperability in Action, what's working now and how we can shape the future. And I think a lot of the focus we have here is on how we can shape the future. And we've designed the agenda, if you've had a chance to look through it, to really focus a little bit on what we can do going forward and what is the important parts of it. I'm really delighted to say that it feels like there's a convergence between where government has been striving to go, and it's arriving at a more innovative, more agile, and a more open space than where we started 10 years ago in terms of technology and business process. And we're also noticing on the industry side that the technologies and the business processes are also emerging and evolving directly in relationship to the demand of more interconnected and more interoperable systems. And so I really feel like there's a convergence happening now where there's an openness, there's a willingness, there's the momentum on the public side, and on the industry side, that's beginning to happen as well. And so we're finding that's coming together. And we've got some great examples of that. Many of you are very familiar with the extension of the Affordable Care Act's 90-10 match money to help really support interoperability, on the A87 cost allocation waiver that's continuing now for several more years. That really encourages states to build systems that are working more effectively together, which is a terrific thing. Jess would have been talking about, I'm sure, the CMSs and CMMIs efforts to fund social determinants of health through their accountable health organization grants that are going out. You may be familiar with those, but they're, I think, the first time perhaps in the federal history that there's actually discussion specifically of social determinants of health in a grant. And there's 44 grants that are going to be made or in the process of being made for about $160 million. So we're really looking at funding programs that are looking at clearly connecting the dots through a social determinant map. And we'll talk about that just a little bit more in detail for those of you who may not be that familiar with it. And then, of course, lastly, we have the new child welfare information system regulations that are just released recently. And we'll hear a little bit more about that. And that really addresses a lot of need that people have to be able to create bidirectional information flows, connecting child welfare to all of the programs that many of you experience going forward. And so we look at that, and we see that convergence happening, and we're excited about it. We just want to be involved in helping direct and focus that energy as we go forward. And I think that that's one of the things that we have, as an organization, been looking at for a long time. When we first got started, we were looking at this convergence and sort of saw the need for this stuff to happen, and in a way saw the trajectory. And might audaciously say that we kind of predicted it going forward years ago. And what we saw, this need to connect the dots between the technology and the interoperability and the business processes, but there wasn't really a word for it at the time, right? We didn't really see it. And we spend a lot of time talking about interoperability and how do you get the boxes and wires to connect to one another and how that would help us move forward. And yet we didn't feel like that was sufficient, right? It was adequate but not sufficient. So we came up with a new word. We came up with the word that many of you may have heard. We call it interoptimability. So I'll say it one more time. Interoptimability. And it's a lot of syllables, and it hurts your teeth the first time you say it. But think about integration, interoperability, and optimization. It's what happens after you get to the place where you've connected the boxes and wires and the businesses. What do you do with that intelligence? What do you do with that? And what's the world look like at that point going forward? So we kind of had that epiphany a number of years ago and have been watching patiently and pushing and urging the field to move forward. And I think that we're at a place where that's actually beginning to happen. Or at least I'm hearing people use that word, which is encouraging, because for years I just get crossed eyes on that one. So think about that. Think about how do we integrate, how do we optimize, and how do we do something new and different. And I think some of the challenges we'll have really will require a new way of thinking about how we go to market, so to speak, and how we do our work going forward. So let me spend just a couple minutes talking about the goals we have for the next couple of days. Because I think it's important that we're clear. It should be obvious from the materials, but I'll just go ahead and mention a few things. First of all, we really want to help stimulate your thinking, and with examples of really innovative programs and practices regarding information sharing and interoperability from a wide variety of organizations. So we'll hear from federal and state and local, some of the association, industry partners, and as well as some of the philanthropies about what they're doing going forward, what's on the leading edge. And it's in a way to just show and indicate some of the innovative stuff that's going on, to get you thinking about who else is doing things. We'll hear about public health aspects, housing, healthcare, education, technology, things that are moving forward that are actually happening at scale in many places and are replicating in multiple locations. So it's great to do experiments, but it's also very important to see where things are happening. And so we've invited a number of people to talk about those experiences from a variety of different venues. So again, we're looking at innovative ideas, things that are scaling across the country, and how we can really take advantage of that. And that's this concept of a network, or a network of networks, which we'll talk about in just a second. But we really want to utilize the energy and attention and thinking of people in this room to explore a really important crisis. Dean Klag mentioned it before. This issue of opioids and heroin and fentanyl now is, as I'm sure everybody in this room is aware, is a tremendous issue. And it is not something that is going away anytime soon. And so as we were preparing for this, and as we started talking more and more to people, it really became clear that this is something that's not just out there, but it's affecting many people in their own families or in their extended communities or at work. So it's an issue that's pervasive, and it's across the whole country. And unfortunately, I'm sure many of you have some experience directly or indirectly with that, unfortunately. And how we address this issue is going to be of great importance. And as we were thinking about themes, this one came out as a really good example to think about information sharing and interoperability. We're not going to solve that problem, and there's a lot of people and a lot of resources and a lot of energy going into looking at the treatment side of opioids and the recovery side, and that's a great thing that's happening. There's bipartisan support for that. There's a lot of energy and focus on that. But as we were really looking into it, we began to see that on the edges, we're not seeing that much. We're not really seeing the preventive upstream energy. Is there a way that we can anticipate this? Or when it starts to happen, is there a way that we can intervene earlier so as to identify the issue, understand what the connections need to be or are not? And so that's a lot of the focus we're going to be looking on over the couple of days. We've got 2 sections of this interactive, one today and one tomorrow, that's going to be looking at that. And you may have seen that in the materials we sent you, the case study. And so we're going to focus a little bit on that. We're going to focus in on it as a way to really talk about interoperability. And now we want to do that both for that conversation around information sharing and interoperability, but we also want to anticipate if we can connect the dots, if we can connect the networks, the people and the organizations that are working in whether or not it's public health or housing or child welfare or transportation, all of those, if we can make those connections a little stronger, a little more clear, a little more obvious, then perhaps we can do some good on this particular crisis, but it might set us up for the future, like Zika, or like who knows what else is coming down the pike. And so that ability to connect networks is, we think, really important. And that happens to a certain degree, but I don't think it happens intentionally enough. And as you look at this process, this crisis around opioids, we see that there's a lot of missing connections, or connections that can be strengthened to get at the issues more clearly and earlier on. We also want to include that idea as part of our recommendations to the federal government for the transition plan. So part of our ambitious goals is to come up with a few really good, solid ideas that we can take forward. And we've gotten a lot of positive response from our federal partners around that in particular. And there's an openness and there's an interest to look at going forward on that. So I mentioned network of networks. I'll just briefly say it again. The concept basically was introduced here a couple of years ago from Charles Picard from the Applied Physics Lab. I don't know how many of you heard his System of Systems lecture. A couple people. It's on the YouTube. It's a great lecture. He described this concept, but really struck with me. I'm not an engineer, but this concept of how, from the military perspective, you coordinate between Army, Navy, and Air Force. They all have their own individual systems, and yet they do need to coordinate. So nobody's building an Uber system for them, but they're building an overlay on top of that. So the 3 systems do their own stuff, but they are able to access information bidirectionally to coordinate what they need to do. That same concept, I think we've taken into this concept of a human sort of a systems of systems or systems of care concept, and how do we connect the networks and the dots? And that's going to be really important. There's some good examples of some efforts that are going on that. Steve Posnick tomorrow will talk a little bit about the Opportunity Project, which is actually beginning to map some of those things on the HIE world, that we may have the opportunity to begin to show what's going on the interoperability on the human services side as well. So we can fail quickly, but also not forget the things that we've done wrong necessarily, and the things we've done right, so we can share those things more broadly, so we don't need to replicate things that have been successful in the past. As I mentioned, fourth, we want to do some work around preparing a transition plan and recommendations for the next administration. And then finally, we want to take some time to think strategically. I think one of the things that I've heard, and I think we've heard as an organization over the years, is that senior leaders rarely have time to think strategically. You all are putting out fires, right? How many people think that they spend 20% of their time spent thinking strategically? Thinking strategically, right? Right. So I'm not seeing a lot of hands up there, right? How about 50% of your time thinking strategically? You're retired. You're retired. It makes it a little easier, Ivan. And so we don't have enough time. There are so many problems, and there's not enough people to do the work oftentimes. So think about this as I was going to use the word retreat, but that's kind of gives sort of the wrong impression. Think of it as an advance, right? So we've got a couple of days to think big thoughts, meet people, talk about ideas, stimulate yourselves, refresh yourselves with some of this without getting bogged down in too many of the nitty-gritty details, although we will get into some of those for sure. We have a lot of time scheduled if you look at the agenda. So between breaks, between lunch, between the interactive sessions we have, we've got a wonderful dinner opportunity tonight. We've got a reception tomorrow night. So there's a lot of opportunity to talk with folks. We're also at lunch today, we're going to have some affinity tables. So for the speakers who are up here, we're going to ask people if they want to continue the conversations, and we'll tell you which those tables are. So if you want to continue that particular topic of conversation, we'll have an opportunity here. If you want to go outside and enjoy the sun and the humidity, by all means, be my guest. So I want to conclude with just a thought on why we're here and why we continue to do this work. So I think of the work that we've been doing here together in the sense of writing a book. So we've written 10 chapters. This is our 11th year. And so one way I think about this is we're adding another chapter to this, right? This is an ongoing story. And you can see some of the outlines from the stories here. These are some of the vision maps we've driven over the years. We've put many of them up on our website. Anthony is capturing this for the visual thinkers in the room, and we know there are many of you. We have invested the time and the energy to make sure we're capturing the story. And this story you can take back with you, and you can contribute to it. And I would like you to think about it as how we're contributing to that ongoing story. As I said earlier, this is never ending. So how do we contribute to that, and what you can take away from it is important. A number of years ago, Stephanie Reel, who spoke to us here, said something that stuck with me as well. She said, the whole field of dreams approach, especially on technology, not so good. It doesn't work out. But if we build it together, and we're on that road together, we're there. We don't have to wait for it to be built and then try to bring people. We're building it, and it arrives, and we're there together with it. And in many ways, I think she was sort of alluding to this idea of an agile approach. Can we build it together and see what's happening and make it real for the people around us, as opposed to waiting for it to be built and then trying to attract people to old ideas and stuff that's outmoded. And so I found that to be very inspiring. One last thought. I remember in 2008, we assembled a similar group. We did this conference for the first 6 years at the Yale School of Management. And when we originally set that date for that symposium, we didn't realize it was actually over the inauguration day. And so as the year unfolded, we made hotel reservations, all that kind of stuff. We were all of a sudden somebody said, oh, you know, it's over inauguration day, isn't that something? And then as we got closer to the election, we said, oh, guess what? We're going to elect the first black president, potentially. And what will that do for us? And so the day came, President Obama got inaugurated, and everybody showed up to the meeting, which was one of my worries, that nobody was going to show up. Everyone was going to stay in D.C. for the inauguration, but everybody showed up. And it was an amazing event. To sit there watching a big screen TV, watching the first black president get inaugurated. And as a group, it was probably one of the most moving moments of a community of really dedicated public servants really doing meaningful work. They were filled with hope and optimism, and they were doing work worth doing. There was a sense in that room of how do we move this forward, and that created a lot of energy for folks. And I've always carried that with me, and it's been tremendously inspiring that a small group of people could do really interesting and exciting things. And then a few weeks ago, I was inspired again. I had the privilege of being invited to the White House for the first White House Child Welfare Hackathon. How many people have heard of that event? It was pretty well publicized. A couple people in this room were there. And it was an amazing event. I felt like we had come full circle. And maybe we had a little to do with making that happen, I felt. We were in the room, and here was a conversation essentially talking about how do we connect systems, how do we generate innovative ideas, how do we bring people into this conversation. And it was an amazing opportunity to see that right there then, with that being embraced by the White House and being embraced by thought leaders from across the country. And there was a lot of young people and not so much gray hair in the room, which was really exciting to see people stepping forward who had excitement and vim and vigor. And I'm excited to say that one of the engineers, perhaps, and one of the motivators of that is a young man who's with us today. His name is Sixto Cancel. Just stand up and say hello. Sixto is an amazing young man with really untiring energy and audacious energy to do stuff and make it happen. And I'm really glad that you're here today to inspire us as well. We'll have a chance, make sure we have a chance to talk with you as we go forward. So we are on a heroic journey. And I think together we can make really tremendous progress moving forward. And I encourage you to engage, commit, and participate and enjoy these couple of days as much as we can. And let's see what kind of great work we can do. So, thank you.